Finally, let's move on to talk about the lockdown files. So the Telegraph have been given access to 100,000 WhatsApp messages by Matt Hancock, or in between Matt Hancock and various other ministers and Whitehall figures. The first tranche of them talk about Hancock's handling of the care homes scandal. Now, Rakib, these are pretty damning, aren't they?
They're very damning. I think that Matt Hancock's efforts to be a relatable figure for the British public, especially after going on I'm a Celebrity, I think they've been shot down in flames very quickly. I think these findings could be very, very damning indeed. It seems to be the suggestion that Matt Hancock went against expert advice and said that he was against the testing, COVID testing for those who are entering care homes from the community. I just have no idea why he would even do that. It sounds absolutely absurd that he would be against that. I think there's very few people who feel that he, in terms of his personal part, that his pandemic-related management was good. I think that his decision-making was very poor. Some of his decision-making in a personal capacity was also very poor, and he paid the price for that. But I think
the famous affair you're referring to with that cost him his job.
And I think that overall that these findings may well even find their way in the COVID-19 inquiry as well, the independent inquiry. And I think more generally, there needs to be a very serious discussion as well about the general regulation of private care homes. I think there was a grand failure of an industrial scale, especially when it came to the shortage of important protective equipment. We saw that the amount of deaths in care homes was a magnificent scale. So Matt Hancock may well have played a part in that, but I think we also have to look at how we regulate our private care homes. And there's many people who pay astronomical fees for their loved ones to be homed in these, to live in these care homes. Where were all those resources, and why were they why were there such shortages when it came to important forms of equipment? I think these questions really need to be asked.
Yeah, definitely. And Tom, I mean, the testing kind of scandal it's worth almost reiterating, isn't it? Because it started off the pandemic policy. The Department of Health policy was, let's kick people out of hospital, put them into care homes. They don't need a test, and even if they test positive, we will put them into a care home. Mm-hmm. Then Hancock changed it to, let's just test people who come from a hospital, but anyone else coming in and out doesn't need a test.
Mm-hmm. Supposedly defying the edicts of
Chris Whitty.
Or advice, I should say. It's worth saying that, because this story, by the time people see this podcast, it probably developed a fair bit more. There's new revelations to come out. Hancock's trying to knock it down. His claim is that his WhatsApp message or exchange, in which he seemed to confirm that, yes, he basically said, yeah, we'll test people coming from hospitals now, but we're not going to do it from the community, was lack context. There was another bit of the message saying that he'd had a meeting and they realised it wasn't feasible or whatever. But I'm not going to take his word for it necessarily. Yeah. And it's also the fact that, as you say, it was just such a horrendous failure that took place there, despite the fact that it seemed surely to be common sense to anyone that this was easily the most kind of vulnerable population, the most concentrated vulnerable population you can talk about. And yet, in the rush to clear the hospitals because of all of the concerns about them being flooded with patients, then you've effectively seeded these outbreaks. Now, I know there's some debate over whether it was actually the community transition, it was via the carers coming in that actually seeded those outbreaks rather than people leaving hospital. Those debates will rage for some time. But even so, kind of, there was even though people like Carl Hennigan were putting forward ideas of really throwing rings of protection around care homes, paying people to stay there for weeks on end. Yeah. There was just no thinking put into this, and there was whereas during the course of the pandemic, a lot of mistakes were made, and obviously the stripping of our civil liberties is easily the highest among them. But at the same time, there could have been a mobilisation of state resources towards protecting the people who really needed protecting. If all of that energy that went into scaring people, everyone stiff, to stay in their homes, to not walk the dog, otherwise you'll be menaced by drones and the police. All of that stuff that was just focused where it needed to be. You do wonder if we'd have had a different outcome, not least because of the fact that whilst we're still waiting for our COVID inquiry to kick into gear, Sweden's already had it, and as we know, in what seems like the final analysis, it's come out pretty well by taking a much more liberal, focused approach. So it's a tragedy, really, but it's also all mixed up with Matt Hancock's semi-comic pursuit of fame and attainment, which seems to be part of the story here as well in terms of his testing target and how that seemed to, at least at some points, shall we say, take more prominence, at least in his thinking, than maybe it should have in terms of doing.
Yeah, he wanted to hit 100,000 tests per day. I think it was by the end of April, and he said explicitly that, you know, in one of his texts, yes, it's fine to send some tests to care homes as long as it doesn't interfere with my target, because, you know, potentially you could have those tests lying around and not being used on the day that would make him look good. I mean, he's kind of a bit of a risible figure, I guess. Rakib, I mean, probably people didn't think much of Matt Hancock before this, but what are they going to think now? You know, can it get worse for him?
Oh, it can. Oh, it definitely can, and I think that these revelations could be especially damaging, and we have to see if there'll be any further revelations as well. I think that more generally, when it comes to I can't believe I'm saying this, but we have to make the point that there were many members of government who were collectively involved in some very poor decision making over the course of the pandemic, not just Matt Hancock. But I do think for him personally, he was trying to repair his reputation, and I think in some ways his fairly impressive performance on I'm a Celebrity, he was making some headway, but now I think he's very much back to square one, and I do think it may well get worse for the man.